Welcome to BoxedIn Health, where health meets wellness, sparking transformative journey to better you. Today, we uncover the topic of cataract. A cataract occurs when the clear lens of the eye becomes cloudy, affecting one's vision. Imagine trying to look through a window that's frosted or fogged up. That's what it's like for people with cataracts. Initially, cataracts may not significantly impact vision, but over time, they can cause noticeable visual disturbances. Activities such as reading, driving, especially at night, and discerning facial expressions become more challenging due to the clouded vision caused by cataracts. In the early stages, adjusting lighting and using corrective glasses can help manage the effects of cataracts. However, if cataracts start significantly affecting daily activities, cataract surgery might be necessary. The good news is that cataract surgery is generally a safe and effective procedure. Common signs and symptoms of cataracts encompass vision that appears clouded, blurred, or dim. Growing difficulty seeing clearly, particularly in low light conditions. Heightened sensitivity to light and experiencing glare. Requiring brighter illumination for reading and various tasks. Noticing halos around lights. Frequent adjustments in eyeglasses or contact lens prescription. Colors appearing faded or tinged with yellow. Occasional double vision in one eye. Initially, the cloudiness affecting vision due to a cataract might impact only a small portion of the eye's lens, often going unnoticed in terms of vision loss. However, as the cataract enlarges, it progressively clouds a larger portion of the lens, causing distortion in the light passing through. Consequently, this leads to more pronounced and noticeable symptoms. The majority of cataracts form due to aging or injury altering the composition of the eye's lens tissue. Over time, the proteins and fibers in the lens start to deteriorate, leading to a gradual blurring or cloudiness of vision. Certain inherited genetic conditions, which may be associated with other health issues, can elevate the likelihood of developing cataracts. Additionally, cataracts can arise from various factors such as other existing eye conditions, previous eye surgeries, medical conditions like diabetes, and prolonged usage of steroid medications. How cataract is formed. A cataract refers to a lens in the eye that has turned cloudy. Positioned just behind the colored part of your eye, known as the iris, the lens is responsible for focusing light that enters your eye and creating clear, sharp images on the retina, a light-sensitive membrane that acts like a camera's film. As you grow older, the lenses in your eyes undergo changes, they become less flexible, less clear, and thicker. Aging, along with various medical conditions, leads to the breakdown and clumping together of proteins and fibers within the lenses, causing cloudiness. With the progression of a cataract, this clouding becomes more opaque. The cataract scatters and obstructs the light passing through the lens, preventing a sharp, well-defined image from reaching the retina. Consequently, your vision becomes blurred. Cataracts typically develop in both eyes, although the rate of development may vary between them. One eye may have a more advanced cataract than the other, resulting in differing levels of vision. Types of cataracts. Cataracts affecting the center of the lens, nuclear cataracts. Cataracts that affect the edges of the lens, cortical cataracts. Cataracts that affect the back of the lens, posterior subcapsular cataracts. Cataracts you're born with, congenital cataracts. Factors that increase your risk of cataracts include increasing age, diabetes, excessive exposure to sunlight, smoking, obesity, high blood pressure, previous eye injury or inflammation, previous eye surgery, prolonged use of corticosteroid medications, drinking excessive amounts of alcohol. Scientific research hasn't definitively outlined methods to prevent or slow down the progression of cataracts. However, doctors suggest several potential strategies that might be beneficial, including regular eye checkups. Scheduled eye exams play a crucial role in early detection of cataracts and other eye issues. Consulting your doctor about the recommended frequency of eye exams is important. Quit smoking. If you smoke, consider quitting. Seek advice from your doctor for effective strategies and resources to help you quit, such as medications, counseling, or other available methods. Manage health conditions. Adhere to your treatment plan if you have conditions like diabetes or other medical issues that heighten the risk of cataracts. Adopt a nutritious diet. Opt for a healthy diet rich in fruits and vegetables to ensure you're receiving a wide range of essential vitamins and nutrients. Fruits and vegetables are abundant in antioxidants, which are beneficial for your eye health. 5. Safeguard your eyes from UV rays. Wear sunglasses that block ultraviolet B, UVB, rays to shield your eyes from potentially harmful ultraviolet light when spending time outdoors. Moderate alcohol consumption. Keep alcohol use within reasonable limits, as excessive consumption can elevate the risk of developing cataracts. Be cautious while driving at night. Limit night driving when experiencing issues with night vision, halos, or glare. Opt for brighter lights during reading and other activities, and consider using a magnifying glass for assistance. To determine if you have a cataract, your doctor will go through your medical history and symptoms, and conduct a thorough eye examination. This examination may involve various tests, including visual acuity test. This test employs an eye chart to assess your ability to read a series of letters. Each eye is tested separately, with the other eye covered. Your eye doctor uses a chart or a viewing device with progressively smaller letters to determine if you have 20/20 vision or if your vision is showing signs of impairment. 2. Slit lamp examination. Using a slit lamp, your eye doctor magnifies and examines the structures at the front of your eye. The microscope, aptly named a slit lamp, utilizes a focused line of light to illuminate your cornea, iris, lens, and the area between your iris and cornea. This focused illumination allows your doctor to view these structures in small, detailed sections, aiding in the detection of any minute abnormalities. Retinal exam. Before conducting a retinal exam, your eye doctor administers drops to dilate your pupils, providing a wider view of the back of your eyes, retina. Using a slit lamp or a specialized device called an ophthalmoscope, your eye doctor can closely examine your lens for any signs of a cataract. Applanation tonometry. This test measures the fluid pressure within your eye. Various devices are available to perform this measurement. These tests help your doctor assess your eye health and detect any indications of a cataract. When your regular glasses no longer provide clear vision, the most effective solution for cataracts is surgery. Cataract surgery involves the removal of the cloudy lens and its replacement with a clear artificial lens known as an intraocular lens. This artificial lens takes the place of your natural lens and becomes a permanent part of your eye. However, in certain cases where using an artificial lens isn't possible due to other eye issues, vision can be corrected using eyeglasses or contact lenses after the cataract is removed. Typically performed on an outpatient basis, cataract surgery doesn't require a hospital stay. Your eye doctor will administer a local anesthetic to numb the area around your eye, allowing you to stay awake during the procedure. Although generally considered safe, cataract surgery does carry risks of infection, bleeding, and an increased chance of retinal detachment. Following the procedure, you may experience some discomfort for a few days, with complete healing usually occurring within a few weeks. If cataract surgery is needed for both eyes, your doctor will plan the second eye surgery after you've fully recovered from the first one. If you enjoyed today's video, don't forget to like, share and subscribe for more informative content like this. Thanks for watching. See you again with another video.